This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Ilara, Research Fellow. Today we're looking at a fascinating new study from the Turkish Journal of Trauma and Emergency Surgery, published in 2026. It's a case report titled Subacute Post-Traumatic Ascending Myelopathy After Cervical Spinal Cord Injury, a Rare and Fatal Complication.
This is a sobering topic, Ilara. We're talking about a condition known by the acronym SPAM, Subacute Post-Traumatic Ascending Myelopathy. For those listening who might be less familiar, this is a rare but absolutely devastating complication of spinal cord injury.
Exactly. The paper defines SPAM as progressive neurological deterioration that extends several segments above the primary lesion. What's particularly chilling is the timing. It occurs within days to weeks after the initial trauma. The pathophysiology is still quite uncertain, and because it's so rare, we don't have standardized treatment strategies.
Right. Let's dive into the case described in the paper. It involves a 38-year-old male patient. Could you walk us through the initial presentation?
Of course. The patient was involved in a motorcycle accident. He sustained a traumatic C6-C7 spondylolisthesis with bilateral facet dislocation. The initial MRI demonstrated cord contusion and edema extending from C5 down to C7.
Standard management for a bilateral facet dislocation would involve reduction, and the paper notes they used traction and reduction before moving to the OR. What was the surgical approach?
It was quite an extensive stabilization. They performed an anterior C6 corpectomy with the placement of an expandable cage and C5-C7 plating. That was followed by a C5-C6 total laminectomy and C4-C7 posterior instrumentation. Postoperatively, there was actually cause for optimism. The authors noted a partial neurological recovery in the immediate days following surgery.
And that's what makes SPAM so treacherous. There is a period of stability or even improvement before the ascending part of the myelopathy begins. What happened on postoperative day 10?
That was the turning point. On day 10, the patient developed quadriparesis that rapidly progressed to complete quadriplegia. This was accompanied by spinal shock and respiratory failure, which required immediate mechanical ventilation.
When you're in the ICU and you see a patient who was doing well suddenly drop their levels like that, your mind goes to a few immediate surgical suspects. How did the team investigate?
They moved quickly to rule out the usual suspects. Imaging studies excluded a postoperative hematoma and any kind of implant failure. However, the paper makes a very important point for neurosurgeons. The postoperative MRI was significantly limited by metallic artifacts from the instrumentation.
That's a classic diagnostic hurdle. Even with modern sequences, that hardware makes it very difficult to see the nuances of cord signal changes. Besides the surgical site, what else did they look for?
They ruled out pulmonary embolism, cardiac dysfunction, and sepsis. Once those alternative causes were excluded, and given the clinical progression of neurological levels ascending above the primary C6-C7 injury, they established the diagnosis of ascending myelopathy.
And unfortunately, as the title of the paper suggests, the prognosis was grim.
Yes. Despite what the authors described as intensive supportive care, the patient died on the 4th day of mechanical ventilation. It highlights that SPAM remains an unpredictable and often fatal complication of spinal cord injury.
It's a terrifying clinical entity. One of the key takeaways I gathered from the paper is the unpredictability. Even with a successful reduction and solid internal fixation, this ascending necrosis or edema can just take over.
The authors really emphasize the importance of clinical radiological correlation. Since we know those metal-related artifacts can hinder the MRI, we can't rely solely on the radiologist's report. We have to watch the patient's clinical segments like a hawk.
Absolutely. If you see levels rising in a subacute window, especially around that 10-day mark, you have to have SPAM on your radar. The paper concludes by calling for vigilant monitoring and continued reporting of these cases. It's the only way we'll eventually refine diagnostic strategies and hopefully find a management protocol that works.
It's a reminder that even when the surgery goes perfectly, the biology of the injured spinal cord can be incredibly unforgiving.
Very well put. That's all the time we have for this episode. Thank you, Dr. Ilara, for bringing this critical case to our attention.
Thank you, Dr. Ilara. We'll see you all in the next episode of the Neurosurgery Hub.